Hundreds of thousands of Arkansans now receive health coverage benefits through Medicaid expansion. But many still waiting to see if their coverage will be returned after re-verification fiasco on a badly backlogged system. KRK4's Marci Manley working for you because dozens of clients say they have submitted information to be reinstated, and charitable clinics say they're feeling the weight of patients forced to wait for coverage they should qualify for.
I'm going to have a stroke because my blood pressure's up so high. I'm running out of medicine.
Carlina Crane visiting the free clinic in Hot Springs for health care that was covered 6 months ago.
I'm ready to pull my hair out. I mean, I don't understand what's happening. Nobody can tell me.
A trip to the pharmacy in June revealed her Medicaid coverage had been canceled.
And I'm going right back to the place I started. What I qualify for is Medicaid.
Coverage was discontinued for more than 60,000 people because DHS said they failed to verify their information. And 16,000 have been reinstated thus far.
Why? Why was it cut off? You know, nothing's changed in my life.
According to staff at Charitable Christian Ministries Clinic, they're seeing a huge increase in patients who have been removed from Medicaid expansion, also known as the private option, during the re-verification process.
They come to see us when they have exhausted all efforts.
The clinic had reduced its hours and staff.
Problems with dizziness or anything?
Because 80% of its patients no longer needed services after Medicaid expansion spread across the state.
I'd be glad to help you with your insurance.
But now Executive Director Lynn Blankenship finds herself fielding calls from former patients needing help to have their health care coverage restored.
And it's only been within the last month that we have found a need to increase our hours because our demand is going up.
The number of free clinics for low-income and uninsured Arkansans cut in half between 2014 and 2015, from 33 to 17. Those that are still open confirmed to us they're seeing the same patient spikes.
They don't have the ability to restaff again.
Dr. Jack Sternberg volunteers for the clinic and had been told his services were no longer needed.
Until 2 weeks ago, I got called back to work.
Because patients have started to return after getting caught up in the re-verification process.
I'm frustrated like the patients are. If you're going to offer people Medicaid expansion or Medicaid assistance, then at least they should be able to get what they deserve and what the law calls for.
Just the medicine.
Members of the clinic staff have seen patients face life and death situations while sitting in limbo these last few months.
Had a patient who was direly sick, was just on death's bed. How do you tell someone like that I'm sorry, but we can't fix this for you and we can't tell you when it's going to be fixed?
According to Lynn, she has just as hard a time getting through the backlogged DHS call center.
Press 2 if you received a renewal notice.
As patients who complain of being indefinitely put on hold.
We are currently experiencing high call volume.
All of a sudden, the rug got pulled out from underneath them, and to try to reinstate them has proven to be challenging at best.
We know it's taken longer than people want. It's taken longer than what we want.
According to DHS, it's working to cut down on the coverage backlog, expanding staff at its call center, and redirecting caseworkers to focus on renewals.
We promise we are working as quickly as we can to get people what they need.
About 44,000 people, or 73% of those whose policy was canceled, remain somewhere in the process.
There could be some who just don't respond, and there could be some who have sent their income verification in and they're waiting for us to go through that.
Carlina crossing her fingers her coverage will get reinstated soon.
You're trying to rake and scrape pennies to get half of your medicine to take for a half a month.
And as she tries to make half doses last as long as she can,
tell us what to do. I mean, give us some way to go.
She's hoping DHS will offer full relief for those stuck in a revolving door of crisis and care.
Families who receive Medicaid coverage through our kids say that their children are paying the price for delays in the state's computer system upgrade. KRK working for you is Marci Manley. Here's from a mom who has spent hours on the phone with the state trying to get her kids' approved insurance activated as doctor bills are being turned over to collections.
Jessica Parson.
Hello. Thank you for calling the Lee County Department of Human Services.
Has called the Department of Human Services roughly 3 times a week since August.
I was calling to check on the status of my children's Arkansas kids.
Her children have received health coverage through the Our Kids program for the past decade. Our Kids is the state's version of Medicaid coverage for children to make sure kids receive medical care if their families meet income qualifications.
I've never had the problem. My oldest son's 14, and they've been on it since they've been born.
But this year, something went wrong, despite DHS telling Parson her children were eligible.
They're approved, they have the same number, but somebody can't hit a switch button.
Now, 4 months later,
I understand you're frustrated because of your kids for your children is not active.
she's still waiting for 2 of her 3 kids to get the green light.
Send it up to Little Rock, and for right now, we don't have an answer.
Even though one of her children was approved and moved on.
You're not getting a runaround. We're telling you the truth.
Act it's like somebody don't know what they're doing. What is the holdup?
Is that acceptable?
No, it's not. That's too long for us. That's not the process that we set up.
According to DHS, this summer it began transferring the Our Kids program from the 25-year-old computer system to the department's new software, which hasn't gone as smoothly as it had hoped.
I imagine it would be frustrating for parents because in this case they did everything they needed to do.
According to DHS, the problem the Parsons are experiencing has impacted about 200 other families, with an unknown error keeping the profiles from registering as active.
They're literally just having to go in there and look at the data files to try to find an anomaly that caused the error.
Locally, DHS confirmed to Parsons she wasn't the only one dealing with delays.
It's not up and running like it should.
But it's hurting the kids that needs to go places.
And I agree, and you're not alone.
But DHS on the state level saying some of the frustrations parents are experiencing may be local offices failing to appropriately follow the process.
We'll be reaching out to our staff again to ensure that they know the process for escalating these cases to ensure they're handled quickly.
According to Parson, doctors won't set appointments for her kids without insurance showing the accounts is activated or her paying appointment costs she can't afford.
Unless we pay the $120, $30 payment plus payment of prescriptions, then we don't go to the doctor. They won't see them no more.
When a serious health issue for her daughter arose in September, the emergency room was her only option.
The ER visit and one is the doctor's bill.
DHS reassured her the trip would be covered retroactively, and the hospital informed of the issue with Our Kids. But she's being stuck with the bill now.
Medicaid saying it's all going to be covered. It's just when they get ready to activate them.
Does that do anything for your credit now that you've been turned over to collections?
No.
Parson, as a working wife and mom, has begun to feel the frustrations pile up.
Been working on them and trying to fix the problem, and you're not alone.
She's left waiting on the other end for a resolution to get her kids the basic care they need and are already approved to have.
Problems pop up on the radar for folks waiting to have the state approve their children's Our Kids First health care coverage. This after we first brought you the story of one mom who fought for 4 months to activate her kids' coverage. We heard from many more of you, and KARK4's Marci Manley took the issue to the top level of state government. And Marci, this isn't just one area affected.
No, Ashley, these are just a few of the dozens of emails, phone calls, and social media messages I received, spanning from Northwest Arkansas and El Dorado to Corning and Ashley County. Because we are working for you, we took the issues to the state to find out why providers and parents are being forced to wait for months for approval that should take just about 45 days. Every day, there have been patients Dr. Laura Williams hasn't been seen.
I saw a child this week with special needs who has an infant sibling that I have not been able to do any of their well child care, and the child is now 6 months old. Here, we're going to check your ears.
Whether it's a 2-month wellness checkup or in some cases serious health conditions, families she would normally serve have been put on hold as the state works through pending Our Kids applications.
The children do not get routine well child care. If they have an illness, they wind up going to the emergency room.
Our Kids First is the health care program for children funded through Medicaid dollars and overseen by the Department of Human Services. And following an issue Working for You highlighted with the system last week,
You can take that and scroll through it and read it.
we received dozens of emails, Facebook messages, and phone calls from families waiting to be processed.
What do you tell that parent that's saying, I'm choosing between rent and my son's $450 prescription medication.
We see these every day.
State Senator David Sanders hears from folks in his district about the same problems getting their Our Kids applications processed.
The system should work. I mean, it's heart-wrenching when you see things like, particularly around this time of year.
Sanders and other lawmakers supported efforts in 2013 to conduct eligibility checks for those receiving state benefits, which required a new software system.
Did you foresee that people would have to wait 6, 8?
Of course not. When it doesn't work, human lives are involved, and there's a real human cost.
According to Sanders, he and others are disappointed by delays that system overhaul has created.
You have the expectation that something you procure, something you buy, something that is supposed to deliver an outcome, you have an expectation that it will work.
So we're aware that a lot of individuals have had challenges with the program. We're just gradually trying to work through those as quickly as we can.
Department of Human Services.
According to DHS Director John Seelig, upgrading DHS's software wasn't a simple task, and working out kinks in the system while receiving higher client volume from the feds proved to be problematic.
We're digging out of that now, but I know people are frustrated as we wait, and we're frustrated too.
At this point, Seelig says the backlog of those waiting for results is improving. For newborns signing up in the Our Kids program, more than 85% of problem cases have been addressed. New applications are being processed, but some families, like those who contacted us, say they've been waiting upwards of 6 months.
Is that too long for these families to wait? What are they supposed to do in the meantime?
Sure. Yeah, it is too long. I mean, we don't want families to have to wait at all. And it's frustrating for our local staff who are working with them, who it's their friends and neighbors, and they want to help them also. And we're making progress, but we're not there yet.
I mean, when do we think we'll be there?
So there's definitely light at the end of the tunnel. It's still, though, it's not tomorrow. You know, it's over the next couple of months or so.
Finish his medicine. All I hear is that, oh, it's getting better, it's getting fixed, and I want to tell you that nothing has changed.
Providers like Dr. Laura Williams are trying to serve patients as best they can in the meantime without going broke.
We're shortchanging the children of Arkansas, and it's not just me. Again, it's everyone.
She can only hope the broken system gets better sooner rather than later to serve kids whose health care is falling behind. Now, 15% of the newborn cases, which many people contacted us over, remain to be dealt with. That's about 1,500 cases affected. For those who are waiting for coverage and have reached out to DHS without results, Senator Sanders encourages you to contact your area's state legislators directly for help. Guys, back to you.
All right, Marci, thanks very much. Keep us updated on all of that. If you have a story you believe needs KARK working for you, you can contact Marci through our tip line, 501-340-4448, or you can send an email to workingforyou@kark.com.